Infections at State House. Now, this is according to Health CAS Rashid Aman, who refused to comment on the matter during Wednesday's COVID-19 briefing. This even as the total number of COVID-19 infections in the country rose to 4,444 after 184 more people tested positive in the last 24 hours. Zainab Mohammed begins our broadcast tonight.
Just 2 days since news broke out about 4 State House officials testing positive for COVID-19, concerns from all over are evident, with the Health CAS saying he is not privy to provide more information about the status of infections in State House. Speaking during the daily COVID-19 briefs, Dr. Aman further cautioned on the use of fake testing kits by private lab that give a false positive to patients, thereby causing unnecessary panic.
For those who are vending these tests, we also want to caution them not to misrepresent the utility of these RDTs in diagnosis of COVID-19 disease. Equally, to our own regulatory authorities, we will in the coming days be streamlining the processes of having these tests on the market and determining exactly for what purposes they can be used.
According to Dr. Aman, only WHO-approved COVID-19 tests should be used by private labs and government facilities.
The so-called antibody-based rapid diagnostic tests, or RDTs. And it is these RDTs that concern us, because these RDTs that have permeated the market and are being vended out there and are being presented as a test for diagnosis of COVID-19 is incorrect. As far as the position of the ministry is concerned right now, the only test that can diagnose and state that an individual is positive for COVID-19 is the real-time PCR test.
Also, the Council of Governors has said only 5 out of 47 counties have fulfilled the 300-bed COVID-19 hospital ward capacity directive by President Uhuru Kenyatta. In a statement to Newsroom, the council says only 453 ICU beds are available across all Level 4 hospitals in the country. For TV47, I'm Zainab Mohammed.